Hey there, Mama. Did you have cholestasis during your pregnancy and wonder if it still matters now that your baby is here? Maybe your itching disappeared and no one ever brought it up again. So, are you completely in the clear? Or does cholestasis actually tell us something about your future health and your future pregnancies? I'm Dr. Jessica Poulin, a maternal-fetal medicine physician here with Femme MD. Today, we're going to talk about what the research shows about life after cholestasis and what I wish every woman understood before leaving the hospital. So, what exactly is cholestasis? Intrahepatic cholestasis of pregnancy happens when pregnancy hormones affect how the liver moves bile. Instead of flowing normally into the gut, the bile acids actually build up within the bloodstream. The classic symptom is intense itching, often on the palms and soles, and worse at night. We take cholestasis very seriously, not just because of the itching itself, but because the elevated bile acids can increase the risks, of course, to the baby, which is why you went through all the monitoring, fetal distress, preterm birth, and then unfortunately stillbirth. And that's why we often use medication, increased monitoring, and sometimes early delivery. Does it go away? The good news is that for most women, yes, it does go away. Once the placenta is delivered and the pregnancy hormones drop, the itching usually improves within a period of days. Liver function tests and bile acids typically return to normal over the coming weeks. But postpartum care shouldn't stop there. If itching persists or if liver tests remain abnormal, that's something that your doctor should evaluate. It can sometimes mean that there's something else going on. Also indicate that there's an underlying liver condition that was first noticed during your pregnancy. Most women fully recover, but we still want to make sure that everything truly normalizes. So what does this mean for your future health? One of the biggest misconceptions is that cholestasis only matters during your pregnancy. Research actually tells us that's not entirely true. Large studies show that women with a history of cholestasis do have a higher risk of future liver and gallbladder conditions when you compare them to women who have never had cholestasis. This does not mean that for sure you will develop liver disease. For most women, everything returns completely to normal. Instead, cholestasis may be a clue that your liver is more sensitive to hormonal changes or that there is an underlying predisposition that pregnancy actually revealed. And that's why it's important to tell every doctor that you see in the future that you had cholestasis during your pregnancy. I also recommend discussing periodic liver function screening with your physician, especially if you ever develop symptoms like a persistent itch, yellowing of the skin or eyes, dark urine, pale stools, or right upper abdominal quadrant discomfort. That's where your liver is. Your doctor can decide how often screening is appropriate based on your history and your symptoms. Future pregnancies. This is one of the most important counseling points. If you have had cholestasis once, there is a high likelihood that it can recur. Studies suggest the recurrence rates to be between 60 and 90%. That's why I strongly recommend a preconception consultation with a maternal-fetal medicine. That's why I strive to trying to conceive again. This visit is incredibly valuable. We review your previous pregnancy, assess your individualized risk, optimize your health before pregnancy, and create a clear plan so that you're not guessing in your next pregnancy. Then, once you actually are pregnant, make sure that your obstetrician knows the history from your first visit and that your MFM physician can help guide monitoring and management, in particular if symptoms appear. And if the itching starts again, do not wait. Call your doctor right away. Early diagnosis is key. So what can you do now? While we don't have evidence that lifestyle changes prevent cholestasis from coming back, there are many ways to support overall liver health. It just makes sense. I recommend a Mediterranean style of eating. Lots of vegetables, fruits, beans, whole grains, healthy fats like olive oil, nuts, seeds, and lean protein. Stay well hydrated. Move your body regularly. Maintain a healthy overall weight. Limit the alcohol. And be cautious with these detox or herbal supplements that can sometimes stress the liver rather than support it. These habits don't guarantee prevention, but they do support long-term metabolic health which can only be beneficial. One of the most important things that I've learned as a maternal-fetal medicine physician is that pregnancy is often a window into your future health. Conditions like cholestasis don't just disappear, they actually give us information. Not something to fear, but something that we can understand. That's the foundation of Vital Femme MD, because postpartum care shouldn't just stop at 6 weeks. It should help women understand what happened, what it means for the future, and how to stay healthy and connected for years to come. If this video helped you, subscribe for more evidence-based education on postpartum complications, recovery, and women's health. And let me know in the comments, did you have cholestasis during pregnancy? What was your story? Until next time, take care of yourself, mama. I'll see you in the comments.